Good evening, everyone. You're most welcome to the University of Warwick MSc in Diabetes Care Information Briefing webinar. It's an absolute pleasure to have so many of you here this evening, and thank you for taking time out of your busy schedule. For the running order for this evening, first Dermot's going to talk to one of our previous students on the programme, Joanne. She's a nurse, and she's absolutely brilliant, and she's been an amazing student and participant on the programme. We're also joined by Dr. Colin Kelly, who is the programme director for the programme, and also our head of academic affairs, Dermot Brannock, who will be giving you an overview presentation about just all the frequently asked questions in terms of curriculum, tuition fees, time commitment, recognition in different jurisdictions, and everything really you need to know about the programme. So I will stay quiet and stop talking and hand you over to Dermot and Joanne.
Thanks a million, Rebecca. So yeah, as Rebecca said, I lead the academic function over this programme. I'm delighted to be joined this evening by Dr. Colin Kenny, who's our programme leader, and by Joanne Walsh, who, as Rebecca said, has been a fantastic asset to the programme and a brilliant student. Joanne, do you want to introduce yourself to everyone on the call?
Hi, I will. Yes. Thanks, Dermot. Hi, everyone. My name is Joanne. I'm currently a nurse. I work in a GP practice here in the Republic of Ireland. I suppose my background has been in emergency medicine and in acute surgical care. And I also did some time in respiratory and palliative care when I was in London. I'm currently on the master's programme at the moment, and I completed my PG dip for the diabetes in primary care in April of this year. So as I said, predominantly my background is in emergency medicine. I'm kind of relatively new to being in a GP practice, but and I suppose I'm quite an advocate in relation to this course that you're all going to hear such wonderful things about this afternoon, or this evening rather. It's not this afternoon anymore. But yeah, so that's a little bit about me. I suppose most importantly is that.
No, I was going to say, what drew you to diabetes, Joanne? Was where I was going to start.
Yeah, so I suppose I felt when I was looking at where I was kind of going career-wise, I kind of felt that I wanted to go into more of a specialised field. And I suppose I wanted probably more to move out into the community and into primary care at the time. And ideally, my kind of goal was to try and go out into a GP practice. I suppose the one area that I wasn't overly confident in was in diabetes. As a nurse who predominantly works in the acute setting, you're kind of very much dictated as to, let's say, with regards to diabetes care, so people who are on sliding scales and things like that, it's all dictated from a doctor, and I wouldn't have had a lot of knowledge or I suppose experience in looking after diabetic patients in the setting. So I did a little bit of research. I actually was on Facebook, would you believe, one particular evening, and I saw the advert for the programme, and I suppose I clicked on the kind of more information, and I suppose the rest is history. It kind of drew me in. It kind of ticked the boxes of things I wanted most to kind of get out of a programme, and I just felt that it was probably the one kind of link in the chain that would have been missing for me to be able to move out into primary care. It very much equips you to work in primary care and to be able to look after diabetic patients effectively.
And I was going to say that I'll get into the whole curriculum areas with Colin, as will Colin later on. But in terms of relevance, you've worked in hospital settings, and you've worked in primary care settings as well. How do you find the relevance of the content on the programme to actual clinically treating patients with diabetes?
So I suppose in primary care, it's extremely relevant because we do a lot of chronic disease management, and diabetes falls under chronic disease. So predominantly in the community, you are engaged morely with type 2 diabetics. So I suppose what the program actually gave you the skills in was actually understanding the diabetic patient. Some secondary problems that diabetic patients can have, like microvascular problems, for example, retinopathy, is one. It allows you to learn more about those, but it also allows you to understand the relationship between the development of these secondary problems that you can get with long-term type 2 diabetes. It also gives you the skill set to be able to assess a diabetic patient effectively. So you do everything from looking at their observations, their blood pressure, the relevance that might have to diabetes, their feet, assessing their feet, the appropriate testing or tests that you would need to carry out on a diabetic patient to ensure that there may be no evidence of neuropathy present, for example. It's also about understanding what are the tests are essential in a diabetic patient, for example, their retinal screening. So it gives you the fundamentals of actually being able to holistically look at a diabetic patient from, their bloods, understanding what they actually mean to the diabetic patient. So your HbA1c, for example, what's normal, what's abnormal, your fasting glucose and all of these other parameters. So prior to actually having done the program, I couldn't tell you probably I never even probably even heard of HbA1c. So, but these are important things that you'd need to know to be able to care for a diabetic patient in the community. So you could holistically assess somebody and you would be able to identify if this diabetic patient was somebody who had secondary problems or had developed new problems from maybe the last time that you assessed them. And it's about understanding where you can see deterioration as well.
And how did you find? I mean, that's it's always great to see that a program that you study has direct clinical relevance, and I think especially around therapeutics and around management of complications. It's in diabetes, certainly that's extraordinarily important. But how did you actually find balancing family, work, study, juggling all the various balls that you have to juggle?
Yeah, I suppose it was probably one of the things that I would have to commend the program most on was actually it being the type of program that facilitated exactly those things. So I had a full-time job, I have children, and I'm predominantly, work full-time at home because my husband works 13, 14-hour days and sometimes 7 days a week. So I'm kind of juggling everything. What I would say is that the program is designed in such a way that it's tailored to meet these, I suppose, if we want to call them trials and tribulations of working life. And the program, suits very much the working person. And I think that the way it's structured and how it's actually conducted is feasible. It allowed me to, you have your tutorial once a week, for example. You might have your weekly information that you would cover. Any questions you may have, you can discuss in the tutorial. It's very detailed and scheduled, so you kind of know what target dates you'd have to set yourself time for. You do need to apply some time in the week. It's not the type of course that you can just turn up to your tutorial, or you can maybe have a glance once every month at the material. You would need to work through it, but it allows you to delegate the time to yourself about when best suits you. And even if you were so I was still based in the hospital at the time. I had I used to be on night sometimes, or I could still be on shift at 8 o'clock in the evening time. So you have recordings, so you're able to sit and listen to your recordings in a time that suits you. So as a mother, it allowed me to have some time in the evening when I came home, or at the weekend if that was my time when I would sit and do my work. I found that if I was organized and I timetabled it into my weekly agenda, then it was really feasible. Yes, it can be a bit hectic at times when it comes to assignments and things like that, but in advance when they have to be in or when they're due or to be submitted. In advance when your exams may take place, and it's just about being organized. So for me, I found being efficient time management wise and being extremely organized allowed me to be able to kind of participate effectively in the course. I would say if people are interested in doing the course, it really does benefit you to participate on a weekly basis in relation to, often you're getting scenarios and they might ask you to contribute, to post up in the discussion group and things like that. And I found it was beneficial for me because it allowed me to maybe get some extra knowledge in, or it allowed me to do some research and get back into the groove of kind of researching again and, doing that. So it was really engaging and extremely supportive. I think if it wasn't for Dermot at the time and for Ian when I was doing my postgrad, they were extremely supportive. So nothing was ever a problem. So I never worried about if there was a family situation or I had a crisis or I wasn't able to attend or anything like that. There was really open dialogue and communication. I felt always really supported, and there was nothing that was ever that was not achievable. So like for me, it really worked. It allowed me to work in my time. And if I wasn't able to attend tutorials, it allowed me to have time to do them in my own time. So
yeah, and I think that's really really relevant, Joanne, that the program is structured as an online program. It's structured such that it assumes everybody has a full clinical load. The average age in the program is in the 40s. Most people have young families. So it needs to be designed with all of those flexibilities in mind. How did you find the assessment, which is always the bit people might be apprehensive about?
I suppose, look, if most people that are interested in doing this have obviously been through some form of university or state exams in their own home countries or whatever that may be, so you all understand like what the pressures of doing exams are. I really felt for me, participating in the weekly discussions, making it my kind of, my target for the week to attend the tutorial unless I was working, and to dedicate a little bit of time at the weekend. Like I have my own way of learning. So for me, it was writing. I write, so I would read the information, I would write it, and that's how I learn. So everybody learns differently. I think if you keep on top of the weekly information, if you participate in the discussions, when it comes to exam time, I think that, it's wise to allocate yourself. Even if, I took a couple of days annual leave from work when it came close to the exam period so that I could study during the day when my son was at school. But that's just because I like to have dedicated time to study rather than like an hour here and an hour there. I think you do need to plan, obviously, in advance when you do want to study for your exams, but they're absolutely achievable. I think the format in which they engage in, so sometimes, you get maybe a question and you might have 2 or 3 options. I found it extremely helpful because sometimes you kind of, when you go into exams and you've kind of a bit of anxiety maybe, or you might be a bit worried, you actually forget sometimes the easiest things. And sometimes when you see them in the actual options, it triggers and you kind of go, oh yeah, that's the answer. I think that you definitely couldn't go into the assessment without having been prepared. And I think that if you keep yourself on schedule every week, and when it comes to having to revise it all, it's not so foreign. But definitely if you didn't do that and you came to trying to wing it before the exams, I think you would struggle. So I think
I'd agree. There is a depth of content, and it gives you, you can't get a very in-depth insight into a subject area without obviously studying that subject area. But at the same time, I think
you couldn't guess, it's not that field of expertise, or it's not that type of, I suppose, condition. It's quite specific. So some of the knowledge is quite specific relative to diabetes, and you would need to make sure that like you had engaged in some form of kind of revision or learning in relation to that particular topic. If you're fortunate enough to work already in the diabetic field, then obviously a lot of it would be kind of not so unfamiliar, so it might be easier. But I came from a background where I did all I knew about diabetes really was that it could lead to amputation, because I worked in a vascular ward and I saw when people had poorly controlled diabetes, what that actually resulted in. Or in the emergency department, it was about getting people on sliding scales that came in that were extremely hyperglycemic, or if they were kind of hypos and things like that. So I apologize, that they were, that their blood sugars were basically all over the place, and they come into the emergency department again, generally because they're poorly controlled, or they've not taken any insulin for a number of days, or whatever the case may be. So that was kind of my only exposure really to diabetes prior to doing the program. So I suppose,
I think it's really interesting that even when we have people on this program that do have experience managing patients with diabetes, they pretty quickly realize just the depth you can get into in any given area. And as part of the induction week, we give people now what is a seemingly fairly straightforward case study. And by the time we actually drill down into it, I think even people that have 20 years experience of managing patients with diabetes, they're surprised at how deep and rich you can go. But Joanne, I'm conscious of time. What advice would you give to someone thinking about coming onto the program who is, a full-time clinician, a prospective part-time learner? What guidance would you give them if they're thinking about it?
I think if diabetes is definitely something you're interested in, just go for broke. I think that just take the plunge. I came from a background where I literally didn't know anything really about diabetes, apart from knowing that it was something related to the pancreas, and studied the basics when I trained as a nurse. And even the depth of knowledge that I've learned, even when I find myself talking like now on different things, I'm actually like going, I almost have to think, am I the same person that I would have been like 6 years ago? I just think if it's definitely for you, for me, I liked it because I like, I suppose the condition is quite clinical, and I like that about nursing. I like having to engage my head and think about all the other factors that are involved. I would say take the plunge. I don't think you'll regret it. The program is extremely supportive. If you're nervous about it, I didn't have a background in diabetes when I came onto the program, so I was totally foreign. I didn't even I didn't work in diabetes at the time. I was actually nearly finished my program when I actually went out into a GP practice. So I think that you don't have to be somebody that's an expert, or you have to be somebody who's really informed about diabetes. I think it applies, and the way it's taught and the way it's laid out is very, very amenable to anybody. If you work in the healthcare profession, it's extremely well supported. And even when it comes to exams, there's a lot of support, there's a lot of guidance there. And I think that it's probably one of the best programs I've done as a student, and I've done a fair few university programs where you feel supported. And with the online, if it's not something you're used to, yep, you will have that inhibition maybe for the first week, but literally once you've been there a week, it'll seem like this is what you would know, it'll just be like every day for you. So I just think take the plunge. If diabetes is definitely something that you want to engage in, I think it's definitely worth it. Every bit of knowledge you learn is something you will apply. So it's not like, where you're learning things that you might not think, oh, I'm never going to use that. You will always use everything you learn.
No, I think that's one of the key things, that as an academic program, it tries to be as patient-centered and as applied as we can possibly make it. But Joanne, look, thank you so much for coming along this evening. Really appreciate it. It's always, I think it's really, really important that people get the perspective of somebody who's on the program, who's managing to get through the program, is managing to balance it with everything else. And your passion for diabetes and your passion for education are pretty inspirational. So look, brilliant to see you again, and thank you so much.
No problem at all. No problem at all.
Colin, over to you, sir.
Joanne.
Well, good evening, everyone. Joanne, thank you so much for that testimonial. It was really... somebody's going to have to let me share the screen here. That seems to be disabled at the minute.
Oh,
There you go.
There you go. That should do it now.
It was really brilliant.
Yeah, it was really great. Thank you so much. Everyone, can you see that? So,
yes,
this is my introduction to the University of Warwick Diploma or Masters in Diabetes. I'm the course leader on that course, and I've been a family doctor with an interest in diabetes for over 30 years. Joanne, thanks for everything. I'm just going to paint a picture for you of what I'm going to cover. I'm going to give you the course overview. I'm going to give you a little insight into what I call the world of diabetes. I'm going to talk about key course content, as Joanne mentioned, and then I'm going to give you an update on diabetes management. So I want to give you a little flavour of the course. It does follow the International Diabetes Federation curriculum. We do deal with type 1s, but also more type 2s. It's run by experienced tutors. They tend to be all involved in diabetes care, so it's practical as well as academic. We do tend to focus what's important in your region, your UK region, and I'll come back to that in a minute. Modern management, we cover individualised care, we give you important updates on studies and guidance. And then it's convenient, as Joanna said, it's an online format, it's flexible to the work when you can, you participate from your office or place of your choice, and we have weekly tutorials like this which are recorded, except that we have a lot of interaction and motivation on those courses. The world of diabetes, I guess you know a lot about this already, but just to say, I've been using this slide here for quite a while, diabetes and its driver, the largest epidemic in human history. I did use that for a while, and of course now it's joined by COVID-19 and diabetes mellitus, unveiling the interaction of two pandemics. And it's just worth saying, on the positive side, people with well-controlled diabetes were 80% more likely to survive a COVID infection than people with suboptimal blood glucose control. But the downside is that almost 50% of the people who died from COVID infection have had poor metabolic or diabetes control. So diabetes is indeed a global epidemic, as I've said. There's 463 million adults living with it currently worldwide. 79% of them are low and middle income countries. 1 in 5 of people over 65 have diabetes. It is 10% of total spending on adults and health expenditure. 1.1 million children have it, both type 1 and type 2, and more than 20 million live births are affected by diabetes in some form. Global inactivity is a big driver for that. We're nothing really great in the UK and Ireland. Kuwait and other parts of the world are much worse. So key course content, Joanna's covered slightly. Let's take module 1 to start with. We tell you how to diagnose diabetes, very basic thing, but that's the line in the sand at 6.5%. Of course, we tell you why that is and what you need to do about it. We talk to you about, we use this in module 3, we deal with the management of diabetes, but this tends to be our Bible, for want of a better word, or what we tend to follow, which is the ADA Standards of Care, just about to be updated for 2022. And just on that subject, next year we'll be dealing with the new NICE guidance that's coming out both for type 2 and other types of diabetes. Then staying with module 3 then, we tell you about the drugs, how to use them, all their different properties. That's oral medication, but of course we also cover insulin and GLP-1s. Insulin itself is 100 years old this year. It's a wonderful story, the insulin story, but there's still barriers to starting injectable therapy. We help you overcome those barriers with your patients. But basically it's the right people, the right insulin, the right dose, the right time, the right strength, and the right device. Because you're a UK and Ireland population, you don't also have to worry about the right price, but if you lived in America, you certainly would. Of course, in a course like this, we tell you where all the drugs work and how. This is a complex slide, but it shows you where the drugs work and why they work. And then we talk a little bit about targets as well. And these targets tend to move depending on what society you're involved with. However, the NICE and SIGN summarize this by saying it's based on individual patient characteristics, preference, potential side effects, and cost are the main features. So in module 2 then, we help you set goals for patients. So you start at the problem, develop a corroborative goal, and validate their goal and plan would be what we try to achieve. In other words, no decision about me without me informing patient choice. We need expert patients, everyone, because people living with diabetes spend 3 hours a year with a healthcare professional on average. For the remaining 8,757 hours, they have to manage this complicated condition themselves, which is why we devote module 2 to helping people to become expert patients. The language you use matters. So in other words, if I'd been talking to you 15 years ago, they'd have been diabetics, but as you heard Joanne saying, they're people living with diabetes, or diabetic patients is the proper way to refer to them. Now, of course, an important part of what we teach you is emergencies. Everyone knows about hypoglycemia or hyperglycemia. I'm sure you saw both in the emergency room, Joanne, and you should be able to recognize this. But imagine you're working in a treatment room tomorrow. You have a 67-year-old patient living with diabetes for a long time. They come into the nurse because their relatives are concerned about their toe. Well, I too would be very concerned about this toe. I'd wonder, there's a lot of callus. This patient's been walking on that part of the foot without feeling it for quite a long time. This is very suspiciously red. But of course, this area is a big area of concern for me, as a GP. Looking at this, I would be very concerned about what was going on there. Was there osteomyelitis? Was there a deep-seated infection? So although I've talked about one emergency, I'm suggesting to you this is also an emergency and needs a same-day referral to secondary care. As part of that, in Module 4, we teach you about microvascular disease, and in Module 5, we teach about macrovascular disease. I'm just in the course of teaching about macrovascular disease to a group at the minute, and just this week we're talking about angina and heart disease. Urine is a very important subject in diabetes. The importance or presence of albuminuria we emphasize throughout the course, because remember, your EGFR might be 45. You might think you have a moderate risk of CKD, but if you have albuminuria, suddenly you become very high risk, and this is a very important risk marker. It's also added another relevance because we've now got a new indication for SGLT2s, which of course we'll be teaching you about, but this is a new nice indication ahead of their new guidance about where you should be using SGLT2s. So just a quick update on diabetes for you. We can't escape COVID-19. I've already told you that the outcomes are more severe in people living with diabetes, but COVID-19 can also precipitate acute metabolic complications in diabetes. Mortality is much higher, as I've told you, but also the other way around, it can precipitate type 1 diabetes as well. When it comes to mortality, it's a very sad story, because once you get over 70, and this is type 1 actually, which is slightly unexplained, your mortality rises very considerably with COVID. So it looks like COVID does indeed attack the pancreas in some way that's yet to be decided. But this just reinforces what I've said already. This paper, which appeared last year, diabetes and hypertension, and especially cardiovascular disease, are important risk factors for the severity and mortality in COVID-19 infected patients, and they should be intensively addressed. We should all be doing that. And I said something earlier about SGLT2s. This is the new emerging data from it, the Emperor R reduced study and the DAPA-HF. Again, we'll be going into those in a lot of detail, as I will just this week, because I'm teaching the students on heart failure and this new emerging evidence. But it has been described as a revolution in the management of heart failure with preserved ejection fractions. The first new agent for that has appeared in a long time. The DIRECT study is a very interesting study. It's done in Newcastle and Glasgow. They're now well into this. There's more than 24 months of data, and it shows very simply, if you get a considerable weight loss greater than 10 kilos, you can put your diabetes into remission. And this is very interesting data. And also it shows that you shouldn't really be gaining weight, because the amount of weight you gain has a direct impact on whether you're running risk of diabetes or not. So this is now essentially my working lifetime. The number of studies that have emerged in that time has really escalated, along with the position papers and guidance. And we'll be telling you all about this. You'll hear us talking about CVOTs, which is a very interesting subject. A lot of them have now published, but there's ongoing publications. But to summarize them in this forest plot, you can see that quite a lot of the so-called newer agents have had a very positive impact on mortality, which certainly wasn't expected at the start of these CVOTs. In turn, it is advised guidance. So currently we're looking at the 19 guidance and what we should be doing. And very simply, this is it. You can see this is the ADA EASD guidance. You can see they break the patients essentially down as to whether they have cardiovascular disease or heart failure. If we look at this closely, you can see the indications if they have heart failure, atherosclerotic cardiovascular disease, or the indications if they've got CKD. And this is a very significant change that the ADA pioneered, and there's a more emerging guidance, but essentially you can see that the new NICE guidance, this is the draft, it's not the finished guidance, by the way, but you can see that for once NICE have followed along, although they're giving less emphasis to GLP-1s. It's worth just pointing out. So there we are, that's what I've covered. Why would you do this diploma? Well, you're working in a very changing environment, as you've discovered if you've been working the last couple of years. I think if you're delivering diabetes care in any form, as Joanne has told us she was, then you have a duty to stay up to date. And therefore, in the University of Warwick IHEAT course, we offer a comprehensive, convenient way to update your knowledge and skills. We ensure materials are relevant and updated. We work with you to develop your knowledge and skills in an interactive form in tutorials. And we support you, of course, with the technology, learning and motivation. So thank you very much for your attention. I'm going to stop sharing there because Rebecca is going to join us and has an important message for us, and I will take some questions on the chat. Thanks so much, everyone.
Thanks.
Yeah, so great, Dermot, I'll hand you over to you for the overall presentation.
I thought you were giving us it. Dermot, go ahead. Sorry, I apologize.
No worries.
Important message. Did I miss
I was like, I wonder what the message is. So what I'm going to do over the course of, and I'm going to do my absolute best to fit this into 20 minutes, is to give you an overview of the program, the structure, the logistics, the assessment, and everything else. So I will go at a reasonable pace, but ask any questions that you want as we go through this. And I've noted a couple down from the chat already that I'll go through. One of the first things that you'll see about the program is you'll see IHEAT alongside the University of Warwick, and we're an online medical education company. We were founded by a family doctor in 2013. We've worked across Europe, Middle East, and Asia for the last 7 or 8 years, particularly with governments and healthcare ministries to develop their capacity, A, in family medicine, but B, in a number of specialist areas like women's health, like diabetes, etc. So what we do is we have teams of obviously faculty, we teams of software and instructional design engineers who create really, really amazingly compelling online content and then deliver that to a global audience. So what IHEAT does is we work with institutions like the University of Warwick, like the Royal College of Physicians, to bring their qualifications to a global audience in a way that is incredibly compelling. The University of Warwick need a little less of an introduction than us. They are ranked 8th in the United Kingdom. They are 62nd in the world. They're an extraordinarily prestigious institution, and we have worked with them to bring their incredible history of diabetes education to a global audience in the UK and Ireland, over the last 15 years, Warwick have 14,000 diabetes graduates. We currently have about 900 people on programs with Warwick at the moment, and you know, they are delighted with the international profile that these programs now have, as well as still continuing to serve the kind of the UK and Irish audiences as well. Warwick in terms of diabetes education, you know, they are absolute thought leaders in this space. They've got a really rich history of diabetes education, and what we'll see in a couple of minutes, the faculty in this program that are both from Warwick and internationally, they're an incredibly well credentialed bunch of people. What is important, and it's a question that we always get asked, is, you know, what's the difference between this qualification and any other qualification that Warwick have? And the answer is none. This qualification is a Master of Science in Diabetes Care. You can also exit with a Postgraduate Diploma in Diabetes Care or a Postgraduate Certificate in Diabetes Care. Your award that you get is the same as any other master's qualification from Warwick. It's not going to mention anything about online learning. It's not going to mention anything about distance education, about it being part-time, about IHEED. It is simply a master's qualification from Warwick. So, you know, the flexibility and accessibility that you get, matched with the quality and the prestige of an award that you get, is really, really important. I mentioned the faculty. There's about 30 odd faculty on this program. I've put up a tiny number of them here, and really to show, you know, like, so Diarmaid Quinlan is the National Diabetes Clinical Lead for Ireland. Colin is a RCGP examiner, past chair of the Diabetes Society in the UK. Pam Brown is on various NICE guidelines committees. Katie Reid has been involved with the University of Manchester in both in public health and in diabetes, and really those specialises in chronic disease management and areas like patient empowerment and behaviour change. Ralph is in the University of Melbourne. He's president of the Australian Society of Diabetes, and the list goes on and on. We've got people from Oxford, we've got people, from Cambridge, not Oxford. We've got people from Oxford, we've got people from across the Gulf. So really, you know, we've got absolute world leaders in diabetes education. Colin covered this to a degree as to what the program covers, but I think to show you the structure is important. So the program is structured into 6 modules for the postgraduate diploma, and then the master's module. And the 6 modules for the postgraduate diploma are, each module is broken into 6 weeks, and each week has a topic. And this is what Joanne was saying at the start, that, you know, it's very easy to structure and pace yourself through the program, because you know right from the outset exactly what date you're going to be doing surgery to treat diabetes, or when you'll do evidence-based medicine. And what is important is where this curriculum has come from, and we follow the patient journey. So while some programs will go deep into the kind of, you know, the pathophysiology of disease, etc., we've decided to take a patient-centered approach. So we start off with finding our patients and, you know, diagnosis and screening, and can you help them prevent moving on to full-blown diabetes. We then look at the self-management of patients living with diabetes, and there's, you know, Colin will speak to the DIRECT study as an example of an extreme version of, if you can get people to adapt their lifestyle and their diet, they can put their diabetes into remission. It's about empowering your patients to achieve that. It's about education programs. It's about your patient being able to manage when they're ill, etc. We then, you know, we move on to therapeutics, and we spend quite a lot of time on therapeutics. And irrespective of your scope of practice, which will differ by geography and differ by profession, we teach you all of the latest thinking on therapeutics. So you come away from the program confident in prescribing, and with a very strong safety ethos around managing patients with diabetes. So semester one, and each of these modules is 6 weeks long. Then you've got breaks for your assessment, and you've got breaks between modules. So it takes about 6 months to get through the first semester. Similarly, the second semester then is 6 months long as well. Again, it's made up of 3 modules. We've got small and large blood vessel complications, and we then have diabetes in specific circumstances like gestational diabetes, like sports and travel, like diabetes in older age. People are living longer, there's more comorbidities, treatment options are changing all the time. So it's really giving you a strong view across the patient journey. Colin, one of the questions that came up on the chat was how much or to what extent do we cover things like non-alcoholic fatty liver disease and things like that?
Well, I've answered that, Dermot, by saying that we do cover it a fair wee bit, but not in great depth. That's an interesting subject, very relevant to diabetes. But the course is such that we can't go into really deep into subjects like that. But of course, we can flag up the literature about that subject, and anybody that's interested in going deeper into a subject can easily follow the literature. And also, we've got a library facility, Dermot, that I think is very good as well. I'm sure you want to talk about that.
Yeah, and I was going to say, I think you're hitting on one of the key transferable skills of the program. So, what people are hopefully seeing on these 2 slides is we're following the patient journey through diabetes, but actually, what you're getting in all of this is an overview of chronic disease management and the chronic care model. And you're getting, aside from all of that, you will have the ability to very quickly research and understand any topic area. You will get so used to reading through literature on topics in diabetes that if you picked up something around that area, that you would read yourself into it in no time. And I think the confidence of being able to read primary research and draw your own conclusions from it is one of the key transferable skills that you get from a program like this. Obviously, our focus is diabetes, but there's the skill set around managing chronic diseases in particular are as relevant to COPD as they are to diabetes. When we get into semester 3, then semester 3 is where you do your professional project, and this is what leads to the Master's Award. And this is a 10 to 12 month module, depending on how long you take at your project. It starts off with a taught module on research methodology, and that 8-week module follows exactly these steps that are outlined here. So it is asking you to think of a research question and review the literature around that area to decide what the best methodology to answer that question is. And then you go into the approval stage and you get your ethics approval, etc. And you then collect your data, you analyze your data, and you write up the paper. And I think what's really, really important is what Warwick asks you to do at the end isn't to write a 15,000 word thesis. It's to write a journal article and to create a conference poster and present it. And I would argue that they are far more relevant assessments of your ability than creating an incredibly long thesis. It is the ability to write in an interesting and succinct way is really, really important. The ability to be able to tell a compelling story is really, really important. So I think that assessment on top of the Masters is extraordinarily important. So in terms then of how the online program works. So, and again, there's been a couple of questions about, is this online, is it not, etc. So we'll start off with a really comprehensive online orientation, and that will bring you through the structure, the regulations, the supports that are available, how to use the online platform. And really, before you start week 1, you're fully comfortable with everything you need to know. Each week then follows a pattern. So we'll start the week with a case discussion about, it'll be related to that week's topic. So it could be on diagnosis, it could be on retinopathy, it could be on cardiovascular disease, whatever the topic is you're studying that week. So you contribute to that during your own time during the week. you then go through the platform with the online content in your own time during the week. So this is really at the heart of the program, is the most amazing visual, interactive, really like absolutely top rate online content. This, I've turned the sound off on this, but this is showing video animation of how retinopathy forms in the blood vessels in the eye. And so I guess what I'm trying to convey here is that in terms of the online experience you will have, some online programs think that putting up PowerPoints and PDFs and the occasional recorded lecture is online education. We deliver through case studies. We have, as you're seeing, an incredibly rich, immersive online environment. So it never really feels like hard work to study the content. There's loads of video, there's loads of animation. You get to the heart of all of the latest research and thinking, but you do it in a way that's incredibly interesting. So you study the content during the week at your own time. So you study that week's topic. And then towards the end of the week, you'd come together with your group of about 20, 25 people for an online tutorial with your tutor. So you could have Colin on a Thursday evening for an hour going through that week's content. And what Colin or any of the other tutors will do is not give you a didactic lecture on the content, but really bring it to life and talk about, well, how would you see this in your clinical work, and what would you do, and what are the things to look out for? What are the common issues? What are the red flags? When do you need to refer? And really kind of bring the contents to life for you. The assessment is really fair and really balanced, and it's also authentic. What the assessment will do is it will ask you to read the literature in an area of diabetes, and then think about how you would apply that to your clinical setting. So again, it's going to be focused on, well, how would you do a diabetes prevention strategy? Or what would you do with a particular patient presenting with a particular set of circumstances based on what the latest guidance says? So you do an essay at the end of the module, and then you've had 2 exams during the program, one at the end of semester 1 and one at the end of semester 2. And those exams are very much testing clinical decision making. The assessment is not something to worry about at all. The assessments are fair. They're based on the content that you've covered. And everybody coming onto this program has a clinical background. They are postgraduate. They've all chosen to be here. We expect people to do very well, and they generally do. And you'll see some of that data in a couple of minutes. So that's kind of what the program structure is. In terms of what it feels like for you, you're in a small group, and we limit the group size in this program, and we limit the number of groups that we take on. So even though it's an online program, it's not one of these kind of massive open online programs. We keep the principles of small group teaching, and that is what gets us the type of advocacy and support that you heard from Joanne at the start of the call. It's an incredibly intimate experience. You get to know your tutor, you get to know your group really, really well, and you feel part of a community. The pace, we survey all the time, we get feedback all the time in the program, and we ask about the pace of the program as one of the things. And the 6-week taught modules, that pace is just about perfect. It lets you get a postgraduate diploma done in about a year. But it's not overwhelming as you go through it. What is important as well is that it's manageable within your clinical workload. So, you heard Joanne at the start, young family, full clinical job, husband has a busy job as well, and she was able to progress through the program, no problem. So, balancing the rest of your life around the program is really important. And I think this, along with the support structures that are in place, one of the key pieces that defines this program is it's not a program that had been brought online because of COVID-19. Every piece of this was designed that it's an online program from the outset. Everybody on it is a part-time learner and a full-time professional. So all the supports and all the structures are there to make sure that that works. In terms of some hard data on that, this program has had, this particular program has had over 500 students from 36 countries over the last couple of years, and that is a mix, probably 60-70% of that are doctors, about 20 to 30% nurses, and then a smattering of other allied, pharmacy and allied health within that, and diabetes educators, but primarily doctors and nurses on the program. Though we've had, I think, the top scoring student of all time in the program is a Malaysian pharmacist, and the second is a diabetes educator from Kuwait. So the interprofessional mix in diabetes care is important, and those people excel at the program as well. I think what you're seeing in terms of pass rates, what you're seeing in terms of engagement rates, it shows that the design of the program works well. The program support, which again Joanne spoke so eloquently of, is extraordinarily positive. There's lots of data that we gather, and I'm conscious of time, so I won't go through this in an awful lot of detail. There's lots of data that we gather on confidence levels in carrying out various things like prescribing for cardiovascular prevention. So, looking at before the program and afterwards, and that flows through. Similarly, we go back, and a couple of years after qualification, we ask people, what has this program done to you? What's it done to your career? What's it done for your patient care, for your reputation with your colleagues? And what you're seeing here is the large and the some positive impact. And, everybody practically is saying, everybody is saying it's had a tremendous impact on patient care. Lots of people are saying this has had a positive impact on their career. Reputation with colleagues, all positive. And then that piece that I spoke about earlier, the understanding of research papers and clinical trials and being able to read and synthesize research on your own, absolutely a vital skill to have, and something that the program gives you, irrespective of the discipline that you're working in. But, in terms of career outcomes, there's some obvious ones, and then there's some less obvious ones. So, if you're in family medicine, GP with a special interest in diabetes care, managing diabetes clinics, the program meets the academic requirement for a diabetes nurse specialist. Our alumni lots of them are involved on national scale programs with diabetes. They are becoming thought leaders in diabetes, which is phenomenal. Obviously, diabetes education, specialist diabetes care like podiatry and dietetics. And again, we have a reasonable number of people that are involved in the pharmaceutical industry working on drug treatments on diabetes. So, while the program is focused on patient management and patient care, there's a very broad career trajectory available to you afterwards. So in terms of how to actually come onto the program, it's really, really straightforward. You have a health science degree, granted a recognized institution, so a health science degree from a university. You need really to be in some capacity involved in patients with diabetes. It is, the program is patient focused, it is clinically focused, so being able to relate that is important. And you need to be able to complete your program conducted through English. That does not necessarily mean that you need to have a formal English language test if your mother tongue isn't English. It simply means that you need to be able to understand the program, and you need to be able to complete the essays. But we don't ask you for a formal English language test. What we do ask you for is a copy of your degree, a personal statement, and again that shows the standard of English, the employer or academic reference letter, and your photo ID. So really, really straightforward application process. That should say March, not October, apologies. So the program fees. The program fees are set, they're set below some of Warwick's other programs, and they're certainly set below other Russell Group and top 10 UK university programs, very deliberately to make the program accessible to a wide audience. and to an international audience. So the price of the Master of Science is £12,000, and the price of the Postgraduate Diploma is £8,000. And they obviously, the 12,000 for the Masters includes the Postgraduate Diploma. There are very significant discounts available if you register early and choose an early payment plan. So, you know, the university really wants to incentivize people to consider joining the program, and those that do early can get a tremendous reduction in the fee. Once you are on the program, then, you know, there's various options around fee payments. Obviously, you can pay up front, you can pay by semester, or you can have a monthly payment plan. And for those in the UK, it's eligible for Student Finance England and Student Finance Wales as well. So, you know, you can avail of that funding structure if that's relevant to you. What I would say, and it goes back to the groups of 20, is these reductions are time bound, but also the spaces on the program will fill up. This program has been oversubscribed practically every time we've ran it. So it's a 22-month program, 3 semesters, 6 months, 6 months, and 10 months. So, you know, you get an amazingly prestigious qualification in a very efficient way. The next intake we're having is 27th of March of next year. There is already a strong amount of applications for the program, and we give the spaces on the program on a first come, first served basis to the people that give us the deposit to secure their place and provide us with their application. So it's very much in your interest, if you are intending to apply, to do so early. Not only do you get the very significant financial discounts, but, you know, you secure your spot. The award from Warwick it's recognised globally for anyone outside the UK or Ireland. You know, we work with regulators around the world to get CPD recognition as well. I think, you know, what I hope we've shown is that the part-time nature of the program, the flexible nature of the program, makes it really, really appealing. What's incredibly difficult to get across in an environment like this is how fun it is, how enjoyable it is. You know, you've got a faculty who are absolutely passionate about diabetes care and who are all really experienced educators. You've got a program management team who is dedicated to you know, driving success in the learners. They support people in a way that, you know, few programs do. They've got weekly contact with everyone. There's an entire infrastructure there to shepherd people along and make sure that they are getting absolutely everything they can from the program. So it is really relevant, it's really contemporary, it is as up to date as you can get, but most of all, it's very, very enjoyable. So I will stop share here, and I'm conscious I went through that really, really fast. But Rebecca, have I missed questions on chat? What's come through? Or if not, very happy to take questions now.
Well, I think we've actually, in fairness to Nullig and everyone, and Colin and yourself, I think we've answered all the questions that have come through in chat. We've all been busy, and it's lovely to see a very active chat. We love that. It means you're really interested rather than just bored. So it's great to see. Thank you so much for all the interaction that we've been having. Just to reiterate some of the things that Diarmuid did cover in his overview, that even though it's online, it doesn't mean that we just enroll with no discretion. We do have caps in every time zone that we've rolled this program out across the globe. So they are between 20 and 30 students per time zone, per region. And so we do have caps, and it is filling fast. So if you are interested in joining the program, I would urge you to apply and pay your deposit at your earliest possible convenience. And if you do that before the 17th of December, you will receive a very significant discount in your tuition fees. I know it's a very tough time of the year to be asking people to shell out money for a deposit for a program, and I'm so sorry about that, but it has to be in line with the start dates of the program, and you do get that discount, which is 1,000 sterling off the cost of the program, which is significant. So please reach out to our education advisors. We'll be reaching out to you, actually, anybody who has attended today, and they're a team of our counsellors who really know the ins and outs of the program, and will be able to tell you in a lot more detail about your payment plans, your monthly payments, if you want to do that subscription method, and just really guide you through the application process. So if you do see an unknown number come up, it'll be a +44 number. Please do, it will be us in either tomorrow or early next week, just to let you know. And yeah, you'll get an email tomorrow with the recording of this event and a link to apply and a link to pay that deposit.
Yeah, absolutely. And someone just asked in the chat, is there an age limit? I think our oldest candidate in the program is 76.
Mm-hmm.
So
we have a few of those in their 70s. So
no, absolutely no age limit.
Yeah, I actually our average is in the 40s.
Yeah.
But yeah, there does seem to be a nice mix, which is good.
Yeah, so brilliant. Look, thank you all so much for coming along this evening. Really appreciate the time that you've spent with us. Hope that the information has been useful to you. The education advisors will reach out and answer any other questions that you have. I hope Colin's given you an insight into the depth of what we go into in diabetes care, and that hope to see lots of you on the program in the future. So thank you so much.
Thank you so much. Hopefully we'll see you in March. Take care.
Bye.
Thanks, Colin.